Records Health Statistics, VRHS Reaccreditation Program informational webinar. We are recording, as you can see there, and today we're looking forward to providing you with an overview of the VRHS Accreditation Program, including its history since its inception in February of 2019. We'll highlight what we've learned about the benefits of pursuing accreditation, and we'll share what's on the horizon for VRHS Reaccreditation. A few general housekeeping notes before we actually dive into today's presentation. Participants have been automatically muted. Please go ahead and use the chat function and enter any questions into the Q&A panel for presenters. Time will be allocated at the end of today's session for questions that are received. And we'd love to interact with you, so we do encourage that you keep your cameras on. Lastly, as I previously shared, this webinar will be recorded and shared. It will be posted as a link on PHAB's website under the Vital Records and Health Statistics page. Just a note also that closed captioning is available within Zoom should you wish to turn on that setting. To enable closed captionings, please click on the CC button in the meeting toolbar as shown in the screenshot. And please note that this screenshot and function may vary slightly depending on the version of Zoom that you're using. You can hide the closed captioning at any time by clicking the CC button again. And with that, I'm pleased to introduce our presenters today. I'm joined by my esteemed colleagues at PHAB, Marita Chilton, Senior Director of Accreditation and Recognition, and Britton Williams, Assistant Director of Accreditation and Recognition. I'm serving as your host today and serve as Senior Specialist of PHAB's Accreditation and Recognition team. We want to invite you to take a moment to introduce yourselves in the chat. If you'll please include your name and the name of your department or VRHS unit. And then I am so pleased to introduce our guest speaker, Mariah Pokorny, who serves as Deputy Division Director of the South Dakota Department of Health Division of Licensure and Accreditation, and also the first accredited VRHS unit and a member of PHAB's Board of Directors. She served as co-chair of the VRHS Reaccreditation Work Group, which led the charge to develop the reaccreditation policy and standards and measures. Please join me in welcoming Mariah, who will provide some opening remarks highlighting the value and importance of VRHS accreditation.
Thank you so much, Emily. So good morning or afternoon, depending on where you are. Thank you all so much for joining the Vital Records Health Statistics Unit Reaccreditation Informational Webinar. We're incredibly grateful for your participation today. PHAB's VRHS Accreditation Program would not be possible without the contributions of public health professionals like you who have dedicated their time and expertise to advancing the public health practice. We know that VRHS provides critical public health functions by recording vital events, tracking life expectancy and other health statistics, and contributing foundational data for effective public health programs to create healthier communities. PHAB is pleased to champion and support VRHS units in their efforts to capture life's most critical moments and translate data into health statistics that can be meaningfully used to inform morbidity, mortality, and health outcome trends. To that end, the VRHS Accreditation Program provides an actionable roadmap for VRHS units, which serves as mechanisms to standardize processes and demonstrate accountability to meeting national performance standards. Today, we're going to share more about the benefits and the impact of VRHS accreditation from the perspectives of units and the launch of PHAB's Reaccreditation Program, including how the standards and measures were developed using transparent and systematic approach that consider the environment in which units operate and learnings from VRHS units pursuing accreditation, new concepts interwoven with those requirements related to health equity, data modernization, and supporting the workforce, and aspects of PHAB's policy for reaccreditation. In addition, we'll cover opportunities for synergy and collaboration between the unit and broader health departments, which support PHAB's mission to advance and transform public health practice by championing performance improvement, strong infrastructure, and innovation. I'll turn it back over to you, Emily.
Well, thank you, Mariah. In many ways, the VRHS Accreditation Program is still new, having finalized the standards and measures in November 2018 and launching the program through a press release officially in February of 2019. The program was launched after several years of planning with our partners and public health practitioners, including VRHS jurisdictional representatives who explored the feasibility and interest of developing a VRHS accreditation program. As part of that development, PHAB launched an alpha test in 2016, which was a preliminary subset of the full requirements, and a beta test using the full version of requirements in 2020 by performing an expedited review process. The first VRHS unit, the South Dakota Department of Health Office of Vital Records, was accredited on February 18, 2021. And since then, PHAB has accredited 4 more to total 5 accredited VRHS units. We want to take just a moment to congratulate the 5 accredited VRHS units, the South Dakota Department of Health Office of Vital Records, Arizona Department of Health Services, Bureau of Vital Records, the Florida Bureau of Health Statistics, the Iowa Department of Health Bureau of Health Statistics, and the Wyoming Department of Health Vital Statistics Services. Beyond these 5, 4 additional jurisdictions are registered or in the process of achieving national accreditation. Eligible applicants include the 50 states, the District of Columbia, New York City, America Samoa, Guam, the Northern Mariana Islands, Puerto Rico, and the U.S. Virgin Islands. And then over the years, PHAB has collected a wealth of data to shed light on the benefits, value, and impact of VRHS accreditation. We're now more equipped with data and insights to know that not only a national voluntary VRHS accreditation program is feasible and of interest, but it has the potential to transform practice and the health of our communities. Several notable benefits of VRHS accreditation include promoting synergy between the VRHS unit and state health departments or broader health departments, establishing a roadmap for standardizing plans, policies, and processes, and fostering accountability and the visibility of the important work of VRHS units. According to a survey of VRHS units that are accredited or in the process of achieving accreditation, 76% reported that accreditation increases quality and performance. 100% identified necessary policies, processes, and protocols not currently in place and needed through the accreditation process. And 57% noted that accreditation strengthened collaboration with external stakeholders. As we embarked on the development of the standards and measures for reaccreditation, the VRHS Reaccreditation Work Group embraced 5 express goals reflected on this screen. First, the work group expressed goals related to reflecting the current aspirations of the field while being mindful not to raise the bar too high. Secondly, the standards and measures for reaccreditation would focus on meeting the intent of measures rather than documenting it, thereby reducing duplication of documents and streamlining requirements to reduce documentation burden. Third, to promote accountability, and for this reason, VRHS reaccreditation incorporates the foundational capabilities from the Foundational Public Health Services model and framework. Stakeholders should feel confident that accredited VRHS units possess key capacities. Fourth, clarify the requirements. This includes formatting changes and separating out the requirements from the guidance and additional enhancements to provide more guidance and additional examples with a focus on meeting the intent of the requirements with careful attention to wording. And then lastly, the goal of reaccreditation's development by the work group was to elevate and strengthen synergies between the VRHS unit and the state or territorial health departments through accreditation. And we'll cover a couple of specific examples later today. The VRHS Reaccreditation Program was informed by multiple different sources, most notably analytical and evaluation data collected from VRHS units during the accreditation process, as well as our frequently asked questions that were received by the field as areas identified as pain points or challenges related to interpreting requirements. In addition, findings from a research study conducted in 2020 shed light on perspectives of both accredited and not accredited or not yet accredited VRHS jurisdictions on the perceived and actual value of VRHS accreditation, as well as associated barriers and challenges faced. Expanding upon the 2022 study, PHAB also convened a listening session with VRHS units to explore specific topics in more detail and to discuss several proposed adjustments to the requirements for reaccreditation. We also convened jurisdictional representatives to further explore insights as part of a VRHS think tank session held in June 2023. And lastly, the PHAB formed a VRHS Reaccreditation Work Group, which was comprised of jurisdictional representatives and really led the charge to develop the reaccreditation program. As is PHAB's standard approach, extensive input was collected from the field throughout the development of the reaccreditation program for VRHS jurisdictions. In June 2023, PHAB engaged a broad range of VRHS jurisdictions, partners, and the National Center for Health Statistics to explore areas in which the field of vital statistics has evolved, as well as some of the benefits and barriers or challenges related to achieving and maintaining accreditation. Through the think tank, several key themes emerged. One was the need to bolster support in the public health workforce by building a supportive work environment and providing professional opportunities for staff. Units were particularly challenged by turnover and morale amid the COVID-19 pandemic. And for that reason, so several of the requirements within the standards and measures for reaccreditation address nurturing a supportive work environment. Secondly, we recognize the need for data modernization, not only specific to VRHS units, but the broader field. And for this reason, we've also incorporated several additional updates related to electronic information security. And then also the VRHS think tank work group identified additional opportunities to infuse health equity concepts as appropriate for VRHS units, including addressing accessibility of the VRHS unit. From November 2023 to May 2024, PHAB convened the work group over several monthly meetings to review the standards and measures and incorporate updates from initial accreditation and based on the work group, the think tank's findings. We also developed a supporting policy that coincides with the standards and measures for the reaccreditation program and additional resources such as PHAB's updated glossary of acronyms and terms. In February 2024, PHAB also hosted the listening session, gathered additional input from VRHS jurisdictions, and explored further ways to incorporate and focus on health equity, such as incorporating American Disabilities Act or accessibility standards into requirements. Once drafted, the standards and measures were released for public bidding over a 30-day period from February 20th to March 22nd, 2024. The input received during public bidding was overwhelmingly positive. The scores for each of the measures reflected that nearly all of the measures should be kept as proposed, with only a few measures rated lower, with recommendations proposed to further clarify the guidance or rephrase the requirements for greater clarity. And I'll now turn it over to Marita Chilton, Senior Director of Accreditation and Recognition, for an overview of the standards.
Thanks, Emily. So the current standards and measures for national accreditation and for reaccreditation of state territorial VRHS units are comprised of these 7 topic areas that are pictured on this slide. So these topic areas cover key functions of the VRHS unit and provide a means to identify performance improvement opportunities, enhance management, develop leadership, strengthen relationships. The standards and measures for initial accreditation, released in November 2018, contain a total of 24 measures, and reaccreditation has 28 measures. So on this next slide, I want to talk briefly about the frameworks that PHAB uses in both Health Department accreditation and VRHS accreditation. The Foundational Public Health Services Framework defines a minimum set of capabilities and areas that must be available in every community and outlines the unique responsibilities of governmental public health. So to promote accountability, the standards designate which measures correspond to the foundational capabilities in the FPHS framework. Engaging in VRHS accreditation and reaccreditation really encourages and stimulates quality and performance improvement in the VRHS unit. So for health departments that are also accredited under version 2022 of the PHAB standards and measures, having this FPHS framework alignment for both the health department and the VRHS unit can provide a synergy and an opportunity for the department that's inclusive of the VRHS unit. Allows you to formalize processes and document how that work is done, which not only helps identify opportunities for continuous improvement, but it's also really key to working efficiently, especially when there's staff turnover. So to achieve and maintain reaccreditation status, VRHS units will demonstrate conformity with these foundational capability measures or complete additional reporting to show that their progress is being made towards demonstrating them. So in the chat, we added a link to the tip sheet. It's on the right side of that last slide that gives you some high-level crosswalks. So another thing about this, the foundational capability measures, it's also an area where the field has really evolved. Oh, it's okay. You can, we're good, which we can look at on this slide. So as Emily talked about a few slides ago, the development of the reaccreditation measures were field-driven. So based on the input from the field, these are the areas that really did evolve. And you can see there are relatively few changes to the standards for reaccreditation. The new concepts do integrate areas where we heard that greater emphasis was needed around data modernization, health equity, administration. For data modernization, requirements were strengthened around preventing unauthorized access to IT systems and ensuring procedures exist to support the VRHS unit's efforts in keeping data systems secure. One of the themes that kept coming up over and over when we talked to VRHS units about where the field is evolving was around utilizing interoperability standards and advancing data governance. So you'll see those reflected in the reaccreditation measures. For health equity, we received feedback that VRHS units wanted some standards to point to that looked internal to the VRHS unit, such as through staff training and orientation, in addition to showcasing how they already support equity work done across the broader health department through topic-specific data reports and engaging in department-wide efforts to advance equity, such as working to reduce communication barriers to customers and end users. Related to administration, feedback received and that was integrated into reaccreditation VRHS standards included a requirement on supporting retention through efforts that work towards improving the work environment and the physical facility of the VRHS unit. We also added a requirement that looks for examples, successful or unsuccessful, of seeking resources to support VRHS units' needs or increasing efficiencies. So integrating these concepts into the standards for VRHS reaccreditation also seeks to harmonize requirements with the broader health department's accreditation. Reaccreditation incorporates more opportunities for collaboration between the VRHS unit and the health department to foster synergy while working towards common goals. Which takes us to the next slide to look at some of these synergies. Earlier last year, PHAB released a fact sheet outlining opportunities for collaboration between the VRHS unit and the broader health department. Organized by domain, this fact sheet outlines some of the ways requirements between the standards for VRHS units and the health departments are aligned, or opportunities for collaboration on joint efforts more broadly beyond accreditation. So I'm not going to read all of the examples here, but do want to highlight just a few of them. In domain 1, we have some engaging in data sharing and exchanging with other entities, as VRHS units are at the forefront of the data modernization initiatives. For domain 2, a continuity of operations plan is required for both VRHS units and health departments. This provides an opportunity to develop a shared plan for continuity events, and also encourages state health departments to really consider the VRHS unit, specifically when revising their COOP. For domain 7, VRHS units maintain critical data systems, which can shed light on access to care needs and populations who experience lack of access or barriers by examining morbidity, mortality, demographic, and other health statistics data. And in domain 9, VRHS units maintain valuable data, which can be used as a part of a health department's performance management system. The implementation of QI projects is required for both VRHS units and health department accreditation, thereby providing an opportunity to really work together on some joint projects. So there you can see there's a lot of different ways that and approaches that can be used to foster engagement and strengthen the relationship between the broader state health department and the VRHS unit, and accreditation can be kind of one avenue towards working towards that. So I'll turn it over to Britton to talk more about the reaccreditation policy.
Oh, sorry. Thank you, Marita. So a little bit about the policy for vital records, health statistics reaccreditation. It was created to closely mirror the policy for health department reaccreditation, including the steps and timeframes for application, documentation, and the site visit. In addition, PHAB recognizes that vital records units may rely on functions performed by an umbrella organization, such as a super public health agency or other super agency, which might include the state health department or a human services agency, or even Secretary of State. So for example, the vital records unit may rely on the IT policies of the broader organization. So we incorporated that as well. There are a few notable exceptions of aspects that are specific to vital record units that we did want to be sure we included, such as eligibility criteria that is specific to the 57 jurisdictional areas identified by the National Center for Health Statistics, and then the technical assistance that is available to all vital records, health statistics jurisdictions through NAPSIS, our partner organization. And then I wanted to also share a little bit about some of the additional resources that are available to vital records units. We do continue to grow a diverse portfolio of resources to support VRHS units. The majority of the materials can be found within the Vital Records Health Statistics webpage on PHAB's website, which houses what you see on the left, or more in the middle, Elevating Vital Records Through Accreditation Impact fact sheet. There's also a sourced acronym and glossary of terms available that can be downloaded, as well as the standards and measures for initial accreditation and their accompanying policies. In addition, PHAB does continue to post training materials within the Learning Center, which includes a VRHS accreditation and reaccreditation journey. And then I believe we've already put in the chat, or we can drop in the chat, a link to that resource page for vital records that is on the PHAB website. For a couple other updates that are in the works that we hope to release later this year for vital records specifically, will be a modified annual report process where we're wanting to incorporate a reflection and learning option. It's kind of a choose your own adventure approach to the annual reporting process, which will allow vital records units some flexibility in how they report on certain aspects in the annual report process. And then we're also working on supplemental guidance to the initial accreditation standards and measures. So if you've looked at the Reaccred standards and measures that have now been adopted, you'll notice that the guidance is much more fleshed out, giving a better description of what the intent of that requirement is and types of examples that could be used. So we're working on a supplement to accompany the initial accreditation standards and measures to give some more details around that guidance, like we've done for reaccreditation. So more to come there. And then this slide just shows a couple of other upcoming events that are being offered by PHAB. There's 2 upcoming webinars around service and resource sharing we thought we would just share with you guys today. There is links on our website to register for those if you have any interest. Those will be in November and are open to anyone interested. And I'll turn it back to Emily as our host.
Thank you so much, Britton and Rita. We'll now be taking questions from the audience using the chat. Please also feel free to use the raise hand feature if you'd like to come off mute. We'd love to hear from you if there's any questions from the audience. I'm not sure that I'm seeing any yet, so I think there was one that came in earlier. How can local health departments learn more about PHAB accreditation in general? And I'll open it up to our speakers today.
Thanks, Emily. Yeah, we have a lot of different materials and resources on the website. So I think that that's a great place for someone to go to if they're just wanting to explore a little bit. And once you're there, you'll see that there are kind of different sections for depending on what you're interested in learning more about. So we have the VRHS section under the program site for the PHAB website. We also have for initial accreditation, reaccreditation, and then we have a general resources tab where you can learn a lot more. The other place on the website that I'd point you to is the education section, and you'll see that there are a variety of webinars and learning events, as well as our learning platform that you can register for and just gain some additional information. So if you are a VRHS unit and you're wanting to encourage your state health department to apply for accreditation, feel free to look at the website. Also, you can always reach out to us, that Ask PHAB website or Ask PHAB email address there, and we're happy to hop on a call and talk about kind of where you are, the best place to get started, and kind of the next steps to take.
So much, Marita, and I see just 1 or 2 other questions. So is there any more that you would share about why VRHS accreditation and reaccreditation programs are so significant? I think we touched on this earlier, but is there more to add?
Would you mind if I jumped in here?
I would love to hear from you.
Awesome. Well, hello again, everyone. Again, Mariah with South Dakota Department of Health. You know, as an accredited state, I can tell you, you know, one of the biggest benefits of accreditation for our department is, as I think we've mentioned before, and there's probably been a lot of webinars on it, but it's really that credibility within the health department. And as you know, sometimes vital records is kind of on an island from the rest of the health department. You know, they know that we're collecting that data that they need foundationally, but not always remembering exactly what we do. So I found that it's really significant to going through this process, because when you look at some of the grants that are coming out from the CDC, for example, you know, the ELC money, the tier 3 money that the vital records got, but also with the FIG support, which is the Public Health Infrastructure Grant. Obviously, that is geared a lot towards the foundational capabilities of a health department. And, you know, obviously that connects very well to vital records and health statistics accreditation. So that's another significant reason that we should be dipping our toes into this accreditation, because it helps us to show that we're performing at the national standards, and just an ability to be able to brag about our program a little bit more.
Thank you so much, Mariah. And then I think we have another question in the chat that came in. When is an organization eligible for VRHS reaccreditation?
So I can hop in on that one. So entities, VRHS units eligible for reaccreditation are those that have achieved accreditation. So they've already been through the initial VRHS process, and then they have completed 4 years of successful annual reporting. And then on the 5th year, we open up a VRHS reaccreditation application, and they are eligible to apply at that point in time. And I'm going to add on to that another question: when are organizations eligible for VRHS initial accreditation? And the answer to that one is after they come to the applicant training. And so we are going to offer, we always offer the VRHS applicant training at the NAPSIS conference. So we do either on the front end or the back end of that conference, we do a session for any of the 57 eligible jurisdictions to attend and learn more and go through an applicant training. This year, we're also going to offer that virtually, probably February, more information coming soon on an exact date. But we want to offer that virtual as well as the in-person to kind of reduce some of the barriers that we know that can happen sometimes with travel and approvals around that. So once an applicant attends the applicant training and they fill out an application, then they're eligible to apply for initial VRHS accreditation. We do like to have people come to that training first, just so that we can make sure that everyone has all the information about what the process is, what's involved in it, and can go in and be really successful. PHAB always wants to see any applicant, whether it's VRHS unit or health department, be successful through the process and have it really aid in that transformation effort.
So much, Marita. And then another question in the chat: is agency accreditation a prerequisite for VRHS accreditation? So does the state health department or the broader health department need to become accredited in order for the VRHS unit to apply for accreditation?
No. So it is not a prerequisite that the broader health department is accredited first. And I think that South Dakota is a great example of that. We think that wherever that state health department is, whatever makes sense for them, that's the path that they should go for. So whether that's having the VRHS unit lead the charge and really be that first kind of like dive into making sure processes and policies are documented, really infusing that culture of quality improvement across the unit. And then the health department comes in and takes lessons learned from the VRHS unit. We think that that is a great path forward. And on the reverse, if it's the broader health department that goes through first and then brings their VRHS unit through the accreditation process, that's another path that applicants can take.
And I know we've certainly heard when the VRHS unit pursues accreditation first, there's learnings from that process for the state health department and vice versa. So lots of opportunities for collaboration. And I'm not seeing too many other questions, it looks like, in the chat. Give it just a moment. There. Okay, question. How does the VRHS program ensure the accuracy and reliability of health statistics? That's a good question.
Mariah, I wonder if you want to take a stab at that one.
Yeah, I'm hesitantly coming off of my video here. I would say, that is a fabulous question. And, if I'm following it correctly, I would say that, you know, we're only as good as the data that is coming into our offices. So the best thing that we can do as vital records and health statistics units is with the quality improvement and the training to our end users on how to accurately report on birth and death information that we're you know, sending to NCHS and collecting for our own states for our population health. So, you know, just to always maintain those lines of communication with our end users, have regular trainings. And I know, you know, Shauna Flax in South Dakota, who is the state registrar, she has a fabulous training platform, the training schedule that she has come up with too, just to make sure that everybody knows we're out there and we're there for technical assistance anytime that we can get in front of, you know, certifiers, whether that be at grand rounds or any coroner training or anything like that. So just being involved in the communities of our data users and just, like I said, keep reminding them that we're there. And you can also run queries and reports. I know that that's something South Dakota does on a regular basis to see anything kind of outside of the norms. And if you're looking for training topics, that's usually an easy one to fall back to see if, you know, if maybe malnutrition deaths are increasing, you know, before NCHS is kind of alerting us to that. Where that's how I'm kind of bringing accreditation into it, that you have all your policies and procedures in place, and then you can really be focused on that quality improvement and learning how to really go back out to our communities. I hope that answered the question.
That's fantastic, and especially some of the requirements for in accreditation, reaccreditation, as you shared about training and users, those contributing data into the system to ensure its accuracy as part of the accreditation process is really important. So thank you, Mariah. We've got a couple more questions that have come into the chat and Q&A. Can you say more about VRHS and standardization and coordination?
Do you want me to take a stab at that too?
Sure, that'd be great.
Okay, perfect. So just a little bit more about the standardization. How South Dakota really attempted this was having really robust standards and procedures for our staff, really to make sure that we're all singing the same tune to our end users, you know, because one person can't really do it all, and making sure that what we're doing is making sense for our program. Meaning, you know, is this, do the funeral directors really have time to go to a webinar once a month versus, you know, meeting them where they're at and doing office hours or something similar to that. So that's kind of how I'm viewing VRHS standardization and coordination is that way through standardizing our policies and procedures. I'm going to read a little bit more into coordination. I'm thinking that you are, that I'm going to look at it from the lens of the broader health department. And I felt like us going through the accreditation process and soon to be through the reaccreditation process, the coordination with the broader health department really increased once we went through the accreditation process, because you know, just the branding strategies and making sure that our work is cited on some of the reports going out from our state epidemiologist and our infant child death review teams, to make sure that, you know, that again, that they're standardizing and talking about our data the way that we are talking about it as well, and we're getting credit for where that information is coming from.
Very excellent. Thank you so much, Mariah. And we have another question. If you started the process but fell off due to COVID-19, etc., how do you pick up back in the process?
I can hop in on that and then invite others to add. And I'm actually gonna kind of pick up what Mariah was just talking about around really looking at those procedures, your policies, making sure that there is standardization. And so the standards and measures for accreditation are going to tell you the what. They're going to tell you, you need a process for this. You need a policy for that. But how you do it is really up to the VRHS unit, the broader health department, the community that you live in. And so how, whether it is that once a month call, scheduled call, or the office hours, whatever approach is going to work for your community is the approach that we want you to take. But so it's really, if you are just trying to pick back up and kind of rebuild, I know a lot of broader health departments and VRHS units are in this kind of rebuilding phase right now. And so if that's where you are, I encourage you to just look at what the measures are, look at the what, and then think about within this next, calendar year, fiscal year, what are those places where you can say, all right, well, we're going to really dig in and make this policy more robust, or we're really going to dig in and look at how we're doing this, or start infusing some quality improvement across, and just one piece at a time, look at bolstering what you're doing and picking back up. And I think that that's kind of the way, an approach that you can take to rebuild. I think another area that I'd point to is if you are from a VRHS unit and your health department, the broader health department is currently accredited, then also looking at some of those synergy places and looking at that tip sheet that we pointed to around how can the VRHS unit be contributing to the health department's broader accreditation, and then vice versa too, if you're interested in going through the VRHS process. Because I think that by having more of that kind of intentional coordination, that you're going to find that you are able to then identify like those places like the coop where, okay, the health department's gonna have to have a coop. So how can then the VRHS unit be part of those conversations, and by doing that, then really be rebuilding what I know was a very, very trying several years, that where there was such a loss in just staff turnover and morale and everything. And my last point here, that by doing this, it really does strengthen having that in place, so that when there's additional turnover, it's not starting all over. You don't have to go through that, picking back up and having to do all of the rebuilding. And I think that's one of the big stories that we kind of heard from units as we were talking to them through this reaccreditation development process. So I know I just said a lot. I'd also invite anyone else, if there are other pieces that you would add in about kind of how to pick back up after COVID.
I'm actually wondering, and follow up to that question, if we could talk a little bit about VRHS units and how accreditation has supported COVID-19. I know PHAB has some impact studies for health departments that are coming out, and how, that there were accommodations made for health departments. There are accommodations if VRHS units or health departments are midway through, if they've already submitted an application. So I would invite anything more from my fellow presenters there about how PHAB is flexible in lieu of those situations and issues to support health departments and VRHS accreditation. Or share about the impact studies.
Yeah, Emily, I think you raise a really good point there around, we do understand that life happens, and on the ground community related events, they take priority, and we know that. And so I think that we, PHAB as an organization, learned so much during COVID about different ways that we might be able to do things and be successful at them. And we actually found some efficiencies in the processes and in the work during that time. We also learned some lessons around like, well, we tried it that way because we had to, and we that might not have been the best approach. So an example of that is like the virtual site visit for VRHS units. We found that virtual site visits for the broader health department, well, that worked okay. we could still do it if, you know, if there's a situation where there's a, you know, major weather event happening or something, and we just need to pivot a little bit. But for the VRHS units, you know, we learned, nope, there is such an importance of being on site because of the security that's required. And so I think that there were so many lessons learned during COVID, and it did allow FAB to learn how to be a little bit more agile and flexible when needed, to be able to be prepared for whatever else comes next. Hopefully it's not you know, a pandemic, but we know that at the state level that each state does experience different things. My thoughts are going to the East Coast right now with the major storm that's coming. And then kind of the impact studies that you alluded to, Emily, absolutely. We will be pay attention to your emails as we release more information, you know, in the coming months around those. I think that there's some exciting things that we have been able to learn and really study and look at, you know, what is the impact of accreditation. And so stay tuned, more coming on that.
Thanks so much, Marita. And then the other thought that comes to mind is that those are ripe with examples of documentation, not to focus on COVID-19, but the pandemic did teach us so much. So whether it was the way that we communicated or addressed misinformation or the way that we captured data, just so many learnings from COVID-19. I'm also thinking about staff turnover. And so that was something that we addressed in the reaccreditation standards and measures as a learning where we could approach ways to build a supportive work environment and really help to retain our personnel or cross-train staff and explore other approaches. So I would say don't shy away from accreditation, use it as an opportunity to leverage all of those wonderful examples. And then there are plenty of different ways to still move forward, albeit maybe at a different pace. And I will give it another minute. I don't see any more questions. Okay, I'm sorry, but I missed the answer. She didn't answer it. We stopped due to COVID. How do we restart? How can you point me in the right direction?
So I think I answered more from a philosophical point than like an actual tactical point. So if you are wanting to re-engage with us, so the requirement is that you attend an applicant training. So we'll have that virtual applicant training offered probably in February. We'll get the date out soon. And then also, as we do every year, we will join at NAPSIS conference to host an do a applicant training with NAPSIS. And then after that, you are eligible to restart in the documentation submission phase. So Charlotte, if I still didn't answer your question, please do reach out. Okay, sounds like it was a tactical one. Yep.
And I am not seeing any more questions. Give it another moment here. And if you do think of things after today's session, please reach out to us at askfab@fabboard.org. Our entire accreditation recognition team will be ready to answer questions and support you through your accreditation journey or general planning. And if no more questions, we invite you to connect with us on our VRHS accreditation website at fabboard.org/VRHS. We also have several social media accounts, so follow us on Facebook, like us, engage with us on Instagram and LinkedIn accounts. You'll see each of our IDs listed here. And I want to extend another thank you for our speakers during today's session, in particular, our guest speaker, Mariah Pokorny, for sharing insights on the importance, value, and impact of VRHS accreditation. We hope this session has been helpful and informative to support your work. And we lastly would very much appreciate your feedback if you would complete our evaluation of today's webinar, either using the QR code here, or we'll drop a link in the chat. And I'll check the questions one more time. It doesn't look like there are any others, so thank you again for joining us today.